Uh, I'm Lori Muzak-McComb, Senior Director of Development, and I'm pleased so many friends and supporters have tuned in this evening. Our virtual chat will begin in a few moments. We'd like to begin with the Land Acknowledgement. In the spirit of truth and reconciliation, and as we gather here today, we acknowledge and are grateful for the opportunity to meet on what is the traditional territories for the Anishinaabe, the Haudenosaunee, and the Neutral peoples. These Aboriginal peoples have been on this land for thousands of years. We recognize their historical connection to it and thank their elders, past and present, for their many contributions. Tonight's discussion features Lisa Short, Executive Director of Cambridge Memorial Hospital Foundation, in conversation with Patrick Gaskin, President and Chief Executive Officer of Cambridge Memorial Hospital. There's just a couple housekeeping items to cover. For the best sound quality, only our presenters' microphones and cameras will be operational this evening. But don't worry, if you have a comment to share, please add it to the chat box. The chat is located at the bottom of your screen. Simply click on it to open, add your comment, and press send. You can move the box anywhere on your screen by dragging it. Thank you to all attendees who sent in questions for Patrick beforehand. We had an excellent response and hope to answer as many questions as possible this evening in the hour we have together. Some align with our topics, and these questions have been included as we discuss them. Others we will pose to Patrick during our question and answer session later in the program as time allows. This event will be recorded and the link will be emailed to all registrants in the coming weeks. Thank you everyone for being with us this evening. Sit back, relax, and make yourself comfortable. We hope you enjoy our first virtual chat of 2022.
Hi, everyone. Patrick, were you aware we only had an hour? I thought we'd be here for a good 2.
Well, I'm a little concerned about that. So
yeah, we're talking.
First of all, can you see me, Lisa? Because
no.
I can't see myself.
And I can't see you, but I'm gonna scroll. I could see you myself earlier and you. So I'm going to see that I've got little arrows at the top and see if I can find myself before we get going here. I can see us both now.
Okay.
Can you?
I can only see you. But
so let's, it's like this is the first time you've been on a Zoom call.
Somebody put in the chat. Thank you. It feels like March 2020 all over again.
But on the top right hand of your screen, Patrick, there's a little view.
Yes, thank you.
And if you go to that, you should be able to change your profile settings.
Oh, side-by-side gallery. There we go.
You're welcome.
Thank you very much.
Good
see
stuff.
What I wore today?
Yes, I do. I see some poppies there, which is absolutely fantastic. I wore a bit of purple as well, just to sort of fit in with the theme. And I look like I'm in the lobby. I'm not. I'm squirreled away in the basement of my house at this point.
Super.
Anywho, a formal good evening and a thank you to everyone for joining us. When I looked at the list of folks on the call tonight, which there are many, there were some familiar names and some new friends. So welcome to each and every one of you. Patrick, thank you for taking the time this evening and throughout the entire pandemic to connect with the community. One of the things that has been amazing is that we've all looked for creative ways to connect with the community, and you've done such a good job, whether it be the town hall, through the region, or talking at chamber events, or finding creative ways to talk to the staff. Thank you for that. And we know you've had a lot to juggle, and we appreciate your efforts to connect with the community. So we'll get right in to things. We certainly, you and I, have the pleasure of and the privilege of working inside the hospital walls. And I think most days there's a reminder for all of us of just how close we are to some of the most emotional times in people's lives. And an incredible responsibility that we have at Cambridge Memorial Hospital to our community. You've been leading Cambridge Memorial Hospital for a few years, many years, and we wanted to get your general thoughts as you start your 12th year at CMH and a little bit longer in healthcare in general.
Yeah, I see how you emphasize the 12th year on,
Yeah,
on that
yeah.
for that.
This-
Is that some hint or something, Lisa? Because I'm
No.
I'm not getting it
Not at all.
for that. So it has been an incredible journey, and we're not going to talk about all the journey. When I thought of that question, because you did give me this one ahead of time, I actually want to talk about what happened on November 30th, like 2 months ago for that. So Nancy's a nurse in our obstetrics program. She had worked at CMH for 40 years, longer than I've been born, actually. Not, longer than I've lived, right? Lisa, as you know.
As I know.
So she finished November 30th at 7 a.m. She started November 30th, 40 years ago, her first shift. She came off a night shift to finish it. And what happened that day was Jillian, her manager, invited Irene, the director, Stephanie, the VP, myself for that. All her colleagues came in. They showered her safely distanced with praise and gifts, and they gave her a framed picture of her flow chart that she had worked on, this kind of patient flow thing that Nancy had worked on over the years and perfected and everything like that. And it just spoke to me of like, it made my day, it made the year, because what it talked about was somebody who had committed to this community, committed to this organization, cared for thousands of people over the years, finished on a night shift for that, honored by her colleagues, framed her improvement that she worked on. So her value of innovation, she was trying to make this place a better and better place. Like that's how I start my 12th year thinking about Nancy and that day.
Yeah, and even looking at the slideshow that was on as we waited here tonight, and how proud it was, first of all, to see people without masks, but just to see the building and just take a step back tonight and look at those faces and those people that are doing their best to serve their community. So I agree, it's pretty wonderful.
It definitely is.
Yeah, so let's talk a little bit. There was a couple of questions that we received, and it's one that you and I are incredibly in touch with, and especially leading the foundation in the work that you do, and that's healthcare funding. So healthcare funding can be a bit of a mystery to folks when we're talking about programs and services versus equipment. And we speak to people in the community all the time, and they're surprised to learn that the community raised funds for the equipment in the hospital and through donations. So it's clear where funding comes from for equipment, I think, or at least that's the message we're trying to get out there, that it's the support of donors. But one of the community members asked about other funding streams. So they'd like to know about, how does the hospital get funding from the government for services?
Yeah, and so it's great kind of looking at the graphic that you put up there, like on the left side, like most of our funding comes from government for that. So about 80% of our funding comes from government. The rest from kind of parking revenue, preferred accommodation, so insurance money, things like that. But the bulk of our money comes through government, and within that, most of it goes to salaries. Like, we're a human organization with great people, and that's where most of our money goes to. In that bucket of what comes from government, it has the various funding streams. So when I started in healthcare, they used to just give you a pot of money, and then you kind of spent it all or more, and then got more money. And now there's what's called global. So there's still some money that's in a pot. And then the large majority of it is based on volume based. So you do procedures and you get funded for them. You do certain care level that you do funded, and you have to do those efficiently, or because you only get so much money and so much funding for them. So the government has moved. So there's kind of much more accountability in terms of the money, and you have to run an efficient operation. As I said, for the global, which is a small portion of ours, they don't really care how we use that money, then they do. But the large portion, which is this patient-based funding, is really critical in terms of how we account for that, making sure we're operating that as effectively as possible. And then, a very important stream, is, as you've got there on the right-hand side, in terms of the work of the foundation for that, because that money, most of that money comes into to us, covers the operational expenses. But government does, with very little exceptions, it does not fund any of the capital equipment side of the hospital, and that's the amazing work you and your team do.
Mm-hmm, mm-hmm. But so for you, what is your role with respect to obtaining that funding for program and services?
Yeah, I love that question when it came in from the community, because I thought, like, yeah, so in terms of, so what clear role we have around is advocating for the money for the resources that we want, or new programs and services for us. One of which we're in the process around in terms of our advocacy work is around dialysis, and happy to chat more about that as the night unfolds for that. And so, advocacy, both of the political stream, but also with the bureaucratic stream in terms of working with that. And then with our partners. So we work with the Ontario Hospital Association, with our other hospital partners in terms of advocacy for the hospital's position, what we need in terms of the kinds of resources. So very much so that role. And then the stewardship of the dollars. So because we have to run that effectively, efficiently as possible, the government's not going to give us money if we're an inefficient operation for that. So there's the advocacy side with government, and then there's the, as equally importantly, the stewardship side of the dollars. So we get, 120, $130 million worth of support from the taxpayers, from the people on the screen. So, it's important that we use that money as effectively as possible to serve the community.
Can you define for us what advocacy means? Like, what does it mean when you're advocating?
Yeah, so it's the phone calls, it's the conversations, it's the meet. It used to be when we actually would go and meet in somebody's office for that, to talk about it. It's speaking about hospital capacity. So one of the issues that we're working with right now is just looking at the capacity for the hospital system across all the hospitals in Waterloo, Wellington. We feel we're underbedded as a hospital system, and that's, I know we'll get more beds with our redevelopment for that, but where we are right now as a hospital system. So kind of meeting with, putting that data together, putting that information together, and making the case and you really start, we do work more with the bureaucratic arm than we do with the political arm, because most of healthcare is funded through formulas, through various allocations for that. So it's not just certain people get money for that. So you really need to make your case. You need to put forward an argument. Dialysis is a good example. So we've written a submission, we put that forward, we've looked at the need, we've done that together with Grand River Hospital, clearly, because they're the regional provider for dialysis. We put that submission before government now for that. We've got letters of support from our MPPs to be able to kind of advocate to move this forward. Because what we'd like to do within the next 3 years is have an ambulatory dialysis program running at the hospital.
That's very much, and that's very much on the radar, right? That's what you're working towards, and that's what advocacy, that's how you're doing that.
For sure.
Yeah. Oh, that's cool. Lots of people in the community want to know how they can help. We know that folks can help by donating to equipment, but I think it's more on the advocacy side of things. What are some of the concrete things that people can do as a community, as community members, with their vote or whatever it might be, to help with the required funding?
Yeah. So let's not undersell the foundation, Lisa.
Well, no, I'm trying to be fair. I know.
Yeah. So we'll set the important work of the foundation aside, but it is the important work of the foundation, and it funds our equipment needs for that. So I think in terms of, we're coming into an election cycle for that. So I think it's the conversations you have when a candidate knocks at your door. It's looking at the health agenda within the various parties for that, and then between elections, it's seeing how do we stack up. It's those conversations I think people should have with their local politicians to say, and mostly I'd say at the provincial level, because most of all of our funding really comes from the province for that. But having those conversations for that, doing that kind of advocacy for that, ensuring that we spend good dollars, joining our board. Like we're looking for new board members as well. So, doing that work around the governance of our organization. So we're run by a volunteer group of citizens of Cambridge and North Dumfries who say, we want the best for our community, and they hold us accountable to the standards and the care and the financial efficiencies that the community wants and needs for that. So I think there's a number of ways. Volunteer at the hospital, donate to that. So I think there's lots of ways of, maybe that's small A advocacy, but that's kind of working within the system in terms of getting the message forward for that. Speaking about the importance of healthcare for that, and advocating, I think, as much as possible in terms of the circles that they move in around making sure that the appropriate care and services is provided either by the hospital or by one of other community providers within the region.
Well, and a shout out to our board members. I think there's a few on this call, and truly a valuable resource for both the hospital and the foundation. Sure. I'll switch gears a little bit and thought we'd touch on the Regional Liver Health Clinic. It's pretty remarkable that during the pandemic, some of these things have still managed to progress. Implementing this initiative is one of those proud things, I think, certainly for me, when I look at ways to better serve our patients and our community. And I can imagine that doing this in tandem with a pandemic has not been easy. So it was open, the liver clinic was open in October under the leadership of Dr. Nguyen. And as I understand it, and from what I know, which I'm sure you can tell us a little more, it's been a real game changer for liver patients in our region. I guess we'd ask maybe that you explain a little bit about the new liver clinic and how the clinic came to be.
Yeah, so everything starts with a vision, with a goal, with that aspiration. And I've got to give a big shout out to Dr. Nguyen on the screen there. For the right-hand side, the man behind the mask. Well, so is Dr. Safaras wearing a mask. You can tell that's a 2021 picture versus the earlier shots that we did.
Yeah, that's right. You can age them out by what kind of mask people are allowed to wear in the hospital.
Are we going to start saying pre-pandemic and post-pandemic? Is that how we're going to talk about life? That so let's back up. It starts with a vision. It starts with the commitment around doing the best possible care for our community. And Dr. Nguyen is the chief of medicine. And I'll back up and even talk about the vision he had to create a intensivist-led ICU. What do I mean by that? What I mean by that is the old days in ICU, most expensive part of the hospital, all that intense one-on-one nursing care, really, really, really sick patients. We had an open access. In other words, anybody could admit to that. So the medicine program or the surgical program, and they would follow their patients in that. Not the best model. I mean, that's the way ICUs used to be run. Now, people move to a model where they're run by intensivists for that. They're run by doctors specialized in that kind of level of intensive care. Dr. Nguyen, the vision around that, we're going to move the organization to a closed access, to an intensivist-led ICU. Check that box. That happened, and thank goodness in the way before the pandemic to be able to do that. So it starts with that vision. It starts with that commitment around how can we do the best we can. We're a community hospital. That's not to be ashamed of that. We're serving 150,000 people in Cambridge and North Dumfries for that. What does that look like? What is the best possible care for that? So it starts with that, and then from that, and cornerstone to that is best possible care, and then what are the services that are needed? So when we looked at liver health under Dr. Nguyen's leadership, we looked at, well, patients have to go. They're going to Toronto and they're going to Hamilton for care. There isn't a hepatologist here in this region that can give the kind of care. We can't, we need to stop people leaving for care that we can do here. So that's really the beginning, the genesis of that, and then a commitment to kind of move forward. Well, what does that mean? That means hiring Dr. Safaras on the screen. And you got to update the picture. Dr. Aziz started on Monday for that. So
sorry.
Yeah, so together, the three of them. And so it builds from that. But it all starts with that commitment, that vision to do the best possible care based on the needs of our patients in our community.
And so with liver health, there was some funding. So it was a bit further out, wasn't it, down the path? And then
it was, and I think that's so in terms of being able to kind of so you get that vision, for that. And then you know that we're in redevelopment and capital needs and all that kind of stuff for that. And then the next catalyst that comes along is the fantastic work of the foundation to partner with the Lyle S. Hallman Foundation, who recognize this need. And you and your team, Lisa, put forward that proposal, convinced the Lyle S. Hallman Foundation to make that substantial investment for that. And that kind of the vision and the dollars and the are key to catalyze it, to be able to propel this forward. And that's essential. Again, the work of the foundation and community support for that, because there's a huge investment to make this happen.
Mm-hmm. And so, what is the clinic do? Like how would the new liver clinic benefit liver patients? I know we're not doing liver transplants. We don't go to that level of care in our community hospital.
Yeah, and when we take a step at looking at kind of what's the purpose of a hospital? I think of it in that wraparound services. So what you try to do is you try to say, well, why are they coming to a hospital? They're coming to a hospital because they need advanced diagnostics services for that. So we're going to be able to do that. They need a hepatologist. Also, we'll get to this for that. So for that, they'll need some dietitian. They'll need nursing support for that. That you'll be able to kind of do that one-stop shopping for it. So someone with advanced liver disease, with cirrhosis, a number of conditions can get access to a suite of services for that. We'll coordinate care that they may need in terms of surgical services for that. We'll deal with them post-transplant, pre-transplant for that. We'll manage their liver disease for that. But it's more than going to a doctor's office. And I don't mean anything against just going to a doctor's. There's lots of things to go to a doctor's office, but that's not what the intention is. It's really to be able to do that and not have to go to Toronto or Hamilton to do that. And to not just do that for the Cambridge residents for that, because it's not offered anywhere else within the region in this comprehensive way for that. We're drawing people, even though we just opened in the last several months, we're drawing more than a third of our patients. So more than 35-40% of our patients are coming from outside Cambridge. They're coming from Listowel and Woodstock and Brant County and even Hamilton that are coming for that. So it's that idea of providing that one-stop shopping, that ability for comprehensive services, for follow-up care for it. And we've even made it simply in terms of even the referral through is all electronic. It's done in the primary care office. They do an online e-referral for that. So it's an electronic referral process for it to be able to do that. They can order the diagnostic imaging and provide that, get that kind of suite of services for that, which is just, fantastic. And it all, comes back to now patients don't have to travel. All the patients that have gone through so far and beyond will not have to travel to Toronto or Hamilton to have that kind of care for that. We'll do procedures as well for that. So it can continue to grow in terms of expanding the diagnostic services that we do, expanding the procedures that we do, coordinating with the surgical services within the region. It's really seen as a regional resource for that. Mm-hmm. And it's serving that right from day one, which is fantastic. And I think exactly what we wanted to achieve.
And so how much of your vision for Cambridge Memorial Hospital includes that care close to home piece? And can you sort of wrap that into that overall vision?
Yeah, I think, I think the liver clinic's really important for that. And it's a part of it's maybe the tip of an iceberg of a foundation, which is got to be a great community hospital. And we've got to do, because what do people want? They want an emergency department they can count on 24 hours a day, 7 days a week for that. And 50,000 people come every year. They want to have their baby here for that. They want to know if their kid needs care, that they can get it. They can see pediatricians get inpatient care. If they slip and fall when they're shoveling the driveway and break their hip, that they can get their hip replaced by one of our amazing orthopedic surgeons for that. Or if they get cancer, they can be followed in our cancer and oncology clinic for that. So, and a suite of diagnostic services. So that is the core of it. That the vision in my mind is, be the best possible community hospital can be, because that's what the majority of people need. And then find those nuggets that you can do that add value and attract doctors, like Dr. Aziz, who just joined us on Monday for that, and Dr. Sasfara, who came and said, attract those docs. Like it's and be able to do that in addition to all that other stuff: 14-bed ICU, surgical services, obstetrics, pediatrics, rehabilitation, all the things that you want to be able to, the kind of a suite of services for a community hospital. I think that's our core. That makes sense?
Yeah, that's helpful. Thank you. So it's clear that innovation is happening here, and I wanted to talk about it just a little bit more. We have an incredibly talented group of healthcare professionals. Here's Dr. Catherine Sawa on the screen, and they bring not only their skills and their expertise, but they're also bringing with them the innovation. And you spoke to Dr. Nguyen and some of his visionary work years ago that have led to the ICU that we have, and also the liver clinic. What does innovation look like in the next year or two?
Yeah, that's a great question. I mean, I think there's
a few other things going on. Yeah.
So I think like for us, it is that continued journey. Like I call it the little engine that could, for that. So that story of kind of that little engine that, trying to get up and over the mountain. And for us, it is thinking about and looking at the kinds of things and the kinds of services that we want for our community. So we've got capital redevelopment isn't finished yet, as you know, for that. So at the end of the day, every program, the next 3 years, kind of every program will be completed and expanded, and we essentially have a brand new hospital for that. And so within that is, how do we continue to kind of do the best we can with the resources that we have? There always will be more things that we want to do. So we want to, in terms of that spirit of innovation, it's thinking of what are those things and those new ideas that we can do. And it comes from that, that little engine analogy I do like, because it's a tiny little engine, and we are a smaller community hospital than some of our partners and things like that. It gives us a very distinct advantage for that, and it gives us that advantage of that nimbleness and being able to respond to it. I back up, like I think it was 2014. Our diagnostic imaging department, under Dr. Lee's leadership, started to look at, let's figure out what an e-referral system would look like, partnered with a tech company, and created a beta site for the e-referrals. In other words, an electronic referral from the doctor's office to the hospital for that. Because believe it or not, Lisa, hospitals operate on fax machines, believe it or not, right? So, and people that know that go to their doctor's office, get in a requisition, or the doctor's faxes it to the hospital. So it's that idea of kind of changing the way, the paradigm, the way we do the work we do. And for me, that's the example of here's the first hospital in Canada or in Ontario or whatever that's created this e-referral system with a tech provider built into it for the primary care practitioners. And now I think I probably have the number wrong, but there's like a 250,000 e-referrals happening every quarter, every year, or whatever for that. This idea, and think about the pandemic when people are seeing their doctor virtually, like now they're going click, click, click and ordering your diagnostic imaging, off goes the requisition, all that kind of stuff for that. In the old days, you walked out with that requisition or things like that. So it is just that idea, that little engine that could, that's Cambridge Memorial Hospital. That's the kind of work and innovation that we want to continue to foster. And it's creating that environment with our medical leaders and our staff that feel they can do that, right? Mm-hmm. We can, yes, I can. Oh, yes, we can.
Yeah.
Yes, we can.
Yeah.
That idea for that.
Yeah. Well, and, Dr. Sawa here, there was featured in the news in December about the all-female led surgical team that performed the first DIEP free flat breast reconstruction surgery in the region of Waterloo. And I probably should say what that acronym stands for. So the deep inferior epigastric perforator free flat breast. Yeah, right? I know I practiced. Yeah. So tell us a bit about the procedure and the physicians involved. And I mean, that's innovation right there.
You want me to tell you the procedure?
Yeah.
see, so my dear wife Fiona says, because when I start talking medical talk, she says, "And when did you get your medical degree?" And I said, "Fiona, I work with them all the time, like it's just by osmosis." After
High level, because
Yeah.
we will have Dr. Salwa on one of these virtual chats in the future, and she can
Yeah.
get into the nitty gritty.
So Dr. Sawa, so another one of these amazing people who we were able to showcase a great environment, super operating room, a great intensive care program, great diagnostic imaging, able to attract to this region, right? So you've got to have all those things in place. Again, those don't come without the foundation, the amazing work that you do for that. But so all of that comes to bear. And then I, what Dr. Salwa did in this amazing surgery was do the nerve grafting. So in terms of taking the tissue from the abdomen and creating a breast mound for that, generally, if you do it, you can do it and not create and not hook up the nerves, and so there's no feeling in there. And that kind of taking it to the next level, which is what she's done, is she's done that micro surgery where with a very fancy set of glasses and magnifying glasses that cost a lot of money, and the right tools and resources provided by the hospital / the foundation for that, is able to stitch those nerves together the size of a human hair. I pull one out to show you how skinny a human hair is, Lisa, but there's not a lot left.
Don't do it.
So she's able to stitch those together, and if successful, then, and it takes time because the nerves to regrow and all of that, then there's actually feeling restored. So not only she's rebuilt a breast with existing tissue of the patient for that, she's restored feeling in that. On that cancer journey, can you think of anything more incredible to achieve than that for people? And that's important to them. And as you say, all female team under her leadership to be able to do that. It's fantastic. And again, bread and butter, us doing cancer surgeries, us having the coordinated care, doing the diagnostic imaging, doing chemotherapy, all of that. And these are, again, one of these shiny little nuggets of care that we can do, and we can do really specialized because we're able to track the people there, and we can do them beyond the Cambridge borders as well. I think that's going to be what we are for that, is kind of having that base level of care and everything for everyone, but then having those nuggets to be able to draw in and just really attract the right surgeons for it, attract the right professionals for it, and serve our community to the best we can.
So is it so it's leading edge surgery, and it comes to happen because of the talent we have, and then the equipment that they can use to do it? Is that how it all?
Well, and the environment, right? So in an environment that actually welcomes that, and says, how can we, right? So how can we set that up? And it is, and again, it's running solid financials. It's having a good operating room for that. It's having strong medical leadership with Dr. Whitehead as the chief of surgery for that, and Dr. Pupalo as the chief of anesthesia. Right. So it's all of those pieces to come together. Anyone can have a fly-in specialist that comes in and does one little thing and flies off or does something for that. But to build that, to create that foundation, to create that environment, to be able to do that, takes all of those pieces to fit together for it. And I think that's absolutely one of the strengths for that. It starts with a vision. So previous head of plastics who said really important to do, and attracted Dr. Sawa to come here, and attracted Dr. Ba to come here as well for that. So to be able to kind of bring that kind of talent to our organization, but they're only going to come if there's there's an MRI and there's good equipment and there's a closed access ICU and an emergency department and a range of services and colleagues that they want to work with for that. It needs all of that. Strong clinical care, good nursing, all that kind of stuff for that. That's all important. It's a team sport.
And a shout out to the recruitment of doctors for the community. That's an impressive thing going on as well. So and there's another picture. Thanks, Alex, for putting that one up there of the team actually at work. Wild. It's so neat.
It is so neat, right?
It really is, and I can't imagine the feeling to have that sort of acknowledgement and be able to do something like that right here in Waterloo Region. That's pretty cool. So as a foundation, we're always asking folks that have had positive experiences here with us to tell their story. And recently in both Melanie and Kim, breast cancer survivors, they've shared their stories. And one of the things that they share most often is they refer to the quality of care that they've had here at CMH. And they, from diagnosis to surgery and to follow-up treatments. And that's very much about the people of CMH, the staff. We've been in a pandemic now for 2 years, and the community sees us managing these waves and hearing about the pressures on our hospital staff and our system. What can you speak to the impact that this has had on the workplace, and especially the people of CMH?
Yeah, I'd be lying if I said people aren't tired. Like it's been 2 years, right? It's been a hard slogging 2 years for that, and we're in the fifth wave, some fourth or fifth, I think it's the fifth wave of it. The highest number of admissions that we've had, the highest level of care that we have, and other people are still sick and need care for that. So it's not just it's more than the 25 COVID patients we have today. For that, it's the care for the rest of our community. So our staff, the neat thing about the staff is like day in and day out. I don't really worry about the weather, for whether staff will make it to work. Staff make it to work. Staff are committed to the organization, committed to caring for our community. But I, be not truthful of saying that people are tired, and so for that, in terms of the extra work that it's required us to do for that, we've had to shut down some of our services for operating room, and we're only doing urgent and emergent surgeries right now for that. And we've worked with that staff to redeploy them. We supported a long-term care home and redeployed staff there as well for a number of months for that, so to be able to do that. And be with staff that are going out and helping with the vaccine work that we're doing in partnership with Pine Bush or our Ontario Health team for that. So, but still in that, like on Monday, where is it? I got a great letter, like on Monday, like this is, and it came like this, it was all like sort of typed like for that. And and I shared it with the managers today, and I we probably can't read all of it, but what this person talked about was wife experiencing cardiac distress for that. And then taken to Emerge, looked after promptly. An hour later, I talked to the nurse in ICU, Frances. She didn't have any details at the time, but she called me back with an update on my wife. Over the course of 5 days, I called 3 times a day. I talked to the nurses who were looking after Mary. Each time I called the nurses, they identified who they were. They patiently talked to me in layman's terms and explained how Mary was doing. Frances, Maverick, Harrison, across the departments, ICU care. Yeah. So just so you think, wow, like your staff are tired. Yeah, I can say that for that. But Francis and Maverick and Harrison and 1,600 others work every day to get emails sent to the CEO for that, and they don't do it to get the emails sent. They do it because it's core to them. But I think the word "I was impressed" is like either 3 or 4 times in this email to me for that, around that. And I think it's just that commitment to serving the community that keeps people focused on the kind of why are they in healthcare? They're in healthcare to do that, to serve that, to give that kind of level of support that. For our community for that. So,
and I've also witnessed, I'm on the operations calls, and I know that the management team, including yourself, are looking at ways how do we support the staff. So can you give us some examples of some ways that you're trying to let the team know how to support supporting them?
Yeah. So recently we've invested, and we've brought in 2 wellness and well-being specialists that actually now work with the organization around. So we've done mental health first aid for our leaders for that. So again, helping leaders treat and support their staff that are within any sort of mental health concerns for that. We've are updating and working on how we do critical incident debriefing. So when something happens in the in the hospital. How do we give that wraparound services? And we had an incident less than 2 weeks ago, and in terms of how do we make sure that the staff are supported through that, because it can, that can be a really challenging situation, and just how do you provide that kind of support for our staff. We've got our wellness team. They were out last night. They go out with the wellness card. So it's reminding them of self-care things, of things that they can do to look after themselves. There's some treats and things like that in it, but it's that time to connect and help, help answer questions, help support the staff for that. I think that those have been really important to it. We've extended we have an employee assistance program for that. So short-term counseling and support for that. We've extended that and made that available to all our physicians, which we had never done before. And like last April, we added the physicians to the pool so that they can have that kind of support for it, that are really important to do that. We've hosted a number of webinars, again, for the staff and ways and opportunities. We've done some fun events for that. You've organized some great food for us, Lisa, you and your team for that. We've had some bag lunches and things like that for that, because we're not celebrating all in the cafeteria like we used to for that. No, so that the way of just recognizing, but at the core is like our leaders try to say over and over again, like, thank you to the staff, like just honor and give thanks to that, and just recognize everybody's working really hard for that, and just that time of saying thank you. Like, I think those are all really important to and I keep saying to staff, all pandemics end for that, and that's the mantra. Like, we're going to get through this, and we will for that. And so it's that kind of approach that we've taken for that.
Yeah. Well, I'm just looking at the time here. I see 7:43, and we will stick to 1 hour because that's what we promised, even though we could talk a lot longer. And we did, I wanted to talk a little bit about the volunteers. And I know we have some volunteers out on the call, and I know they wish they were in the hospital. We had them back for a little bit, which was just the best feeling in the world to see those faces again in the hospital. We know volunteers have always been very important to the vision of our hospital and providing exceptional care. When do you expect volunteers will be able to return this time?
Well, Lisa, I keep 3 pictures on my desk for that. So, and I didn't tell you this, but I brought props. So one says, "Don't ever give up."
Fair, yeah, that's a good one.
So that's a good one.
Yeah.
The second one, that's you and me.
Oh, that's right. When we dressed up.
Do you remember that?
Christmas.
So just for people on the call, that's Lisa in the Winnie the Pooh outfit. That's Lisa.
That's right. Well, what are you wearing? Are you an elf?
I think I'm just an elf. That's
elf.
Christmas 2018 when we did our staff.
That's right.
Staff and the kids
for the children's event. Yeah.
That was a lot of fun. Remember back then?
Yeah.
No mask. And the third picture is with Dennis, the volunteer.
Yeah.
For that, don't tell Fiona. There's not a picture of Fiona on my desk for that. So the volunteers are like, we love and miss our volunteers so much, and we are working to try to bring. So first of all, we always want volunteers to be safe, and they only coming back if they feel safe, and we can create a safe environment for that. So volunteers, like all the staff, are vaccinated. They have all the PPE that they need, personal protective equipment for that, and trained in terms of being able to do that. And use their PPE correctly for that. So we want them back if they feel comfortable to come back. And we are working towards later this month to start to reintroduce volunteers. Now, I say that just because I heard it today at a meeting at 2 o'clock for that. So more to come and what that would look like. But we desperately want them back. They enrich the patient experience. They enrich the staff experience. They help, improve the environment for everyone. And so they are a critical part, and we hope to have them back soon.
Yeah, that will be very good. Well, there's a good reason to join the virtual chat right there, that you get news hot off the presses, and hopefully that happens this month. That's really great news. I'm just reading through some of the questions that we have here. What message do you have for patients and families that may find themselves in the hospital or in the ED during a pandemic? What do you want them to know?
Yeah, it hasn't been business as usual, as people know that, across any business environment for that, and it hasn't been business as usual for that. And so even right now, with 100% virtual visiting instead of kind of patients, their loved ones in for that, certain exemptions apply for that. Is just recognize that within that environment, the staff are absolutely committed to the care and service for our community. And within that is always prioritizing the most urgent patients. So I know at times people think, oh, you wait a long time and emerge. The author of this letter did not wait a long time and emerge. And you know why? Because the most sickest patient, bumped some other things and went in for that. So like we always triage and look to the care of the most urgent at the time for that. And also to realize the staff are operating in a way that they don't want to operate either. They don't want to not have the loved ones there for that. Like they don't. So we have put an extra burden on our staff by saying, no, we're virtual visiting, we're all that kind of stuff. That's not what they're used to for that. And so we've added that level for it. So it's just recognizing, and I know people are tired of it, right? People have had enough of this and want to go back to something normal for that. So I can't stress enough kind of that abundance of kindness and patience for that. Like it's just a different environment and a different time. And it's not that you're not important for that. Like everyone's important for that. We're always going to triage and work on the most urgent cases and situations for that. But if there is no beds in the hospital and we've got patients backed up in emerge for that, and we can't get you in because we can't get the patients in the hospital because we can't get some patients discharged, it's part of that is some system issues, it's some flow that we have to work on across the system for that. But it at the core is still the staff really want to do the best they can for the patients each and every day for that. Kindness, patience goes a long way, and just and never not ask questions, never not advocate for yourself for that. Like all that aside for that, but I just think it's just kind of remember it's still not business as usual for us in terms of the work that we're doing right now.
Mm-hmm. I think that's helpful. We also put in the chat if anybody needs to reach out to the patient experience lead, if they can provide any, any information where we can learn and grow as an organization. I think we'd be open. I don't want to put words in your mouth, but open to that as well.
Oh, clearly. Like, and we had yesterday was our patient family advisory council. So again,
right.
People that want to join our patient family advisory council, it's all about improving our care for that. And again, they're talking about care experiences and how to make it better at CMH. And we've been meeting since 2014, a group of dedicated patients and patient advisors for us that I think is like critical. And again, we're always recruiting.
Yeah, exactly. Yeah, because you want people around that table that can help move things forward. Absolutely. Construction was another big question. People wanted to know where we're at, where we're going. Are we on time? What are the phases of renovation, and what new departments will be in Wing B?
Yeah, so Wing B is exciting and underway. So people that have been through the hospital realize that they're already seeing things like the second level of Wing B2 for that is already kind of under major redevelopment. We at the end of the day, we will finish and renovate all the inpatient areas in B Wing, as well as the full, so what I'll call the first floor of it, which is diagnostic imaging and laboratory services. Later this month, the new CT, which arrived, the pink donut that you sent some pictures out of arrived for that. So that will be opened later this month for that. And it's part of kind of a multi-phase, I think the diagnostic imaging is 7 or 9 phases of construction, because we have to keep diagnostic imaging running while we're doing it. Same with laboratory services for that. And so we're still finalizing the timetable. We have Ellis Dawn as the contractor for this phase of the work. Fantastic contractor, on time for that, working with our capital redevelopment team. We're still looking at ways around how we can accelerate the program, the timetable for it. Right now, I think it's June 2025 is when we're finished all of it. But as I say, we're trying to look at ways as to how to, working with the contractor in terms of how to try to streamline that in order to do that. We will come to a stage soon, actually, where we have to decant Wing B, and decant I think is what most people think you do with wine or something like that. But for us in the hospital business, what that means is we're going to move all the patients out of Wing B and move them to Wing C for that, and so that we can do have a good kind of 2 years to renovate the inpatient areas. For that. More to come on that. That's not for a few months down the road. We'll do more communication with the community about that. But yeah, multi-phases, on track, great contractor, super capital redevelopment team, 2025 at the outset. Let's, fingers crossed, great work. We might be earlier.
Yeah, and so when it's all done, like it'll be, it'll all look like the new wing. Is that the plan?
It will. It won't be floor to ceiling windows that we do in the new wing, but in terms of room sizes, single occupancy rooms for that. We won't have any ward rooms. So we worked with government to make a change to our drawings, because we had a ward room on each floor. So that's a 4-bedded room. Yep. So we've got rid of those. We've got support from government who will fund that change to the drawings and the design for that. So we'll only have semi-private and private rooms on each floor. We'll have a medical floor, a surgical floor, and rehabilitation. So those are the inpatient services that we'll have. Again, kind of very similar to what you see in Wing A, in terms of room size, bathrooms, lifts in the rooms from a patient safety point of view. So patient lifts in the rooms, that kind of design. It'll have negative air pressure rooms, which we have on each of the programs in Wing A for that. So that idea of trying to maximize and make it as much as possible. I always call it a brand new hospital, and I'm really not far off that.
No.
Now it's in terms of what that's going to look like at the end of the day.
And some growing pains while we're moving this. You use the word decant, but we're going to need some patience from the community while that's happening, I would think, because you're going to be in an old section of the hospital using that.
It is. Unfortunately, we have to use Wing C. So that's the 1953 section of the hospital, probably for about 2 years for that. The rooms aren't, we're done some work and renovations in those areas, but they aren't, they aren't like what Wing B is even now, and they aren't like what Wing B will look like at the final stage for that. So it's going to be
a significant time frame, right? That's a significant time frame. Yeah,
it is.
So it's good for people to know.
It is, just kind of get a sense that it is. It's a bit of through the and again, it's going to be program specific. It's not like, oh well, can you pick Wing A or Wing C that you go to or whatever. No, kind of depending on
what's going on.
Yeah.
How important was it to have the new wing open in January of 2020 before that pandemic hit in March?
Wasn't that? It's January 2020. I got to wear that, and I put it on.
You wore that.
I did, and it's a little tighter this time, so it shrunk somehow. We're hanging in the cupboard for 2
That's
years,
right.
But I got to wear this when we were doing one of those celebratory events, Lisa, you and I, and the community. So so critical for that. So, we've talked about the intensive care units. Most of our patients for Delta, for the Delta variant for that at the early days ended up in ICU. 12 beds, single rooms for that, top-notch equipment for that, $250,000 a room or whatever it is in terms of outfitting those rooms. We were able to, because the way we designed the intensive care unit, right beside it is 10 beds of medicine, but they were all designed to be what we call step down, or kind of a lower level of intensive care if we needed. We converted all of those beds to that kind of secondary level. At one point, I remember touring with Dr. Lee, the interim chief of staff, and we were coming through on a weekend, and I think there were 17 patients in the 16 vented COVID. And so we took our 12 full and we went down the hall. So having the rooms, having the capacity to increase our ICU, having the negative pressure room. So each room in the emergency department is a room now. It's not a magic curtain that's preventing separating you between patients for that. So you've got the kind of single occupancy emergency department. You've got negative air pressure rooms in every single program, and we've had COVID in every program in the hospital. Not that you need patients to be in a negative air pressure room, but we didn't know at the time for that. So having the extra space for that. So as we've had to ramp up and add capacity within the organization, we were able to, because we had moved into Wing A, as it's called, for that, we had an empty unit we on Wing B. And what did we do? We got beds and equipment and a pharmacy cabinet called Omnicell, and we outfitted a unit, and it was just freaky. Again, Dr. Lee and I walking around this unit like, holy smokes, we can just like open this up and turn on the switch and put in more patients. And that's what we did. So it was, if a pandemic's going to come, it couldn't have come at a better time for us.
Yeah, and like the teamwork of you know, and all the different parts that had to come together to create that space and be, that was a really neat time. I was impressed, absolutely. We don't have too much more time, but can you touch just briefly on OHT? Because there was a few questions about the Ontario Health Teams. That's what that is.
Yeah. So new model of care for how we're going to organize services called the Ontario Health Team. We're members of the Cambridge North Dumfries Ontario Health Team. We were one of the early, so government announced application for this 2018 or 19. We got approved for that. We are 18 agencies that are looking at how we provide care differently to patients for that. So it's involving primary care, the hospital, community agencies, mental health agencies, and the real goal around it is kind of what I'll call one-stop shopping or integrated care for that. So the different agencies kind of working together for seamless care. So we talk about warm handoffs, that idea of a patient who gets discharged from the hospital, getting the follow-up care that they needed from their community provider for that, or even prior to coming to the hospital, they're getting that level of care. So it's us working together in terms of how do we design care differently, particularly for mental health and addictions, for medically complex patients. So, healthcare is a disjointed system for that because you have different providers and different rules and different things and different referral forms and all that kind of stuff for that. So how do we take it especially for the most complex patients, how do we organize care differently for that? So that's the commitment, that's the journey that we're on the Cambridge North Dumfries OHT for that. 18 full agency members for that. We have 13 that are affiliates, so they're part of it, but not have kind of as fully invested in it. We've made a commitment to kind of how do we work together on that path around improving care. What are the digital enablers? So what's the information technology that might help connect us differently for that? What are the patients saying? So we're recruiting a patient engagement lead in terms of how we work with patients. What do they want? And what do they want that system of care to look like for it? Right now, our OHT, amazing work that they're doing for that, and the staff with it are really focused on the pandemic, on supporting our providers through the pandemic right now.
Yeah. Oh, well, so interesting things to come, and looking at new ways of doing things and trying to work together. That's not a bad way to end this conversation. Patrick, thank you as always. We are so blessed to have you at the helm. I look forward to a time when you can take more than 5 days off in a row for you. I look forward to that so that you can rest and recharge. I don't know how you do it, but boy, is this community lucky to have you doing the work that you do, and the team, of course, behind you is pretty impressive as well. So thank you.
Well, you're welcome. And it's a team sport, and it really is. Like, first of all, nobody wants in this community me to provide 1 ounce of care to them, because that would be dangerous for that. So behind and working with me are 1,600 staff, and 400 volunteers, and 300 medical professionals that want to care for this community and do the best they can, provide amazing care, grow services, meet the needs of our community. And so it's an honor to serve in this organization, to serve our community. And man, like, we just touched the icing on the cake.
I know they should have given us 2 hours. They should
have. But people have to go and do their Wordle.
That's right. That's a big thing.
I haven't done the Wordle for the
there
day
you go.
for that, so I got to go and do that.
And thank you. Patrick is also our signatory for our February appeal letters, so look for that hitting mailboxes soon. I wanted to thank my team behind the scenes. They do not want to be seen on camera, but there are about 3 folks doing their magic behind the scenes. So I'm grateful to a team that makes Patrick and I look pretty darn good, I think. And to all of you that joined us tonight, thank you for sharing your time with us. Our next virtual chat will take place in celebration of International Women's Day in March, and we hope you will join us on March 7th at 7 p.m. for our next chat. Thank you, everybody, and good evening.